How can Kinesio Tape help patients with cystic fibrosis? I'm Dr. Michael Lee, performance consultant and certified Kinesio Taping here in the UK. So thank you so much for joining me today, because the answer may surprise you. So if you are a clinician, or a physiotherapist, chiropractor, osteopath, or even a doctor that actually looks after it's usually kids, oh actually they do get older kids, of course, that has cystic fibrosis. Of course, we know it's a mechanical problem. It's a mechanical problem that, of course, the mucus just cannot be mechanically shifted well enough, because, of course, being born with cystic fibrosis, they don't have these small little villi that kind of move the mucus upwards against gravity. So the question is, how can we use Kinesio Tape to actually help these types of patients? Because the fact is that if the patients themselves don't have the structure, we have to think of a way that can actually increase mobility of the rib cage, of the muscles around breathing, so that it can actually encourage that movement of mucus. Because let's be real here. If the mucus isn't moved, these patients will have higher chances of infections, pneumonia, right? All the other complications that will affect not only their well-being, but of course the efficiency of breathing. So we're probably thinking, how can Kinesio Tape actually improve this type of thing? Well, we know that Kinesio Tape can actually change how muscles contract and also relax. And it's about making sure that we are finding out in that person's system what isn't working very well. And we also need to think about what are the main muscles that are needed to actually expand the rib cage, increase lung volume. Because think about it, if we can actually get more oxygen in or more air in, it's going to expand more. There's already more movement in the rib cage, and of course, if there's more movement in the rib cage, then when actually the air goes out, then there's more movement to actually push any mucus up towards either the throat to be spat out or to swallowed, or even if they're getting any other treatments, because a lot of them do get say a lot of manual therapy, whether it's massage, whether it's cupping or tapping, or petrissage, what you call effleurage, petrissage, in terms of getting rid and moving, mechanically moving that fluid away and the mucus away from the ribs. So, of course, the first thing we would actually be doing, number one, is this. We need to make sure the diaphragm's working, because that's the main muscle that helps with breathing, right? Because, of course, if the diaphragm is not functioning normally, then, of course, breathing is going to be inefficient anyway. So what we're going to do is, of course, we're going to facilitate the diaphragm. We need to make sure the diaphragm can contract well enough and then relax well enough to really expand that rib cage, but also allow space below into the abdominal cavity to expand too. Because if that expands, there's more space for the lungs to expand, and then, of course, there's more space for the lungs to expand, there's more mechanical movement to then, when it actually contracts and also relaxes, to push that mucus upwards. So we definitely need to get that working. The other thing is that if we know that certain patients are, say, for example, they're really phlegmy, or if you do an auscultation around the lungs, you might feel, oh, yeah, it's upper left lobe or upper right lobe that actually has the most crackles, and then we have the most the most fluid, of course. Then we may need to tape in those areas, and you should be thinking mechanically, what's not working there? Then we may need to be taping. Of course, how do we facilitate the intercostal muscles? And if we're getting those working, then of course that may be able to help specifically or locally in that area. But of course, we also were thinking about how can we do other applications, like we call it the space correction. Space correction is creating more space underneath within the tissue itself. Because remember, when we're applying Kinesio Tape, if you've ever learned this, when you see that, we call it the little wrinkles, they're the convolutions. When there's convolutions, that's the lifting mechanism. And when there's lifting, it creates space underneath. And if we can do that, particularly around a certain area that feels really bunched up, whether it's scar tissue, whether it's just poor posture, or whether it's your muscles that are really tight, maybe your pecs are really short, and that's actually causing everything to actually close up at the front, then actually maybe space correction will just help open everything up or even we can even do something at the back if we know that everything's if they're so flexed or so kyphotic around the rib cage. We might need to improve their posture and make them into an opening up and improve that kyphosis. We could actually use something called functional correction, where it's actually high tension. So it's actually, I call it like an elastic application, where it's going to pull everything back, and they got better posture, and of course got better posture, they're going to have better gas exchanges, and when they have better gas exchanges, they'll have better lung volumes as well. So these are just actually simple ways in terms of how Kinesio Tape can actually help, because the great thing is Kinesio Tape is using what our hands would be doing, creating space, mechanically moving mucus, and ultimately helping these patients breathe better. So I really hope that you found that this is really interesting, because we always think, oh, Kinesio Tapes is all about how do we help with healing, help with fluid, and help with edema, hematomas, help with balance and muscle contractions. Yeah, it is. But we also apply it because it's about doing it smartly and thinking, actually, how smart can I be, and how can I really be creative to really help these types of patients so that they can live healthy and happy lives too. So if you really find this interesting, and you're probably also thinking, oh, but I'm not sure what these terms you're using, functional correction, convolutions, that's okay, because we have a live teaching in December in Sheffield, where I'll be the instructor for you, and we'll be more than happy to teach you all the fundamentals that Dr. Kenzo Kasei actually created. And he's the inventor. He created Kinesio taping, the tape itself, and how to apply it. And I'll be teaching how he intended to use it. Because, we see lots of different kinesio courses out there, and we know they all learn from, of course, the kinesio taping method from Dr. Kenzo Kasei, but we find that it filters down and the quality tends to kind of reduce with it. So we always look for clinicians that want the best, but also want it firsthand from the inventor as well. So if that's something you would like, just put me into the chat, and one of our advisors will contact you to see how you can register for that course, because the spots are filling up fast, and we want to make sure that if you want to be positioned with all the tools to make sure you can help your patients, doesn't matter, and ultimately it doesn't matter what they're struggling with, because Kinesio Tape can actually help. We'll give you those tools, how to apply it like an expert, so you know exactly what you're doing, and you can get those consistent, great results. And of course, your patients are going to love you for it as well. So thank you so much for joining me today. Make sure just put me in the chat if you're looking to learn further to actually improve your clinical skills. And I'll be more than happy to see you then, and I can't wait to teach you as well. Thank you for joining me, and I'll see you next week. Bye for now.